Welcome back to the Lost Book of Herbal Remedies, everyone. I'm Emma, and today we're diving into some groundbreaking new developments in diabetes care. We're talking about stem cell therapies and natural remedies that could change the future for millions living with diabetes.
Absolutely, Emma. One of the biggest breakthroughs we're seeing is the use of stem cells in diabetes treatment. Imagine this. A 25-year-old woman with type 1 diabetes managed to reverse her condition entirely. After receiving a transplant of reprogrammed stem cells from her own body, she started producing her own insulin. And here's the kicker. More than a year later, she's still insulin-independent.
It's incredible. This case shows us what the future of diabetes care could look like. Instead of relying on insulin injections for life, this woman is now free from them, thanks to those reprogrammed cells. The procedure involved taking her own cells and transforming them into insulin-producing beta cells, the kind that are destroyed in type 1 diabetes.
Yeah, and the technique they used is pretty amazing. The researchers at Peking University used small molecules to reprogram her cells into what we call pluripotent stem cells. Basically, cells that can turn into any type of cell in the body. Then they formed these stem cells into clusters of islet cells, which were transplanted into her abdominal muscles.
It's such a clever approach. By placing the islets in her abdominal muscles, they could monitor the cells better after the transplant. And it's not just this one case. In Shanghai, a similar approach was used with a man who had type 2 diabetes. After a liver transplant of insulin-producing islets, he stopped needing insulin altogether.
That's what's so exciting. These stem cell therapies could not only restore insulin production, but offer a personalized approach that reduces the risk of rejection because they're using the patient's own cells. And we're seeing this across the board. Stem cells are showing real potential in diabetes treatment.
Now, while reversing diabetes is huge, we can't forget about another issue that affects a lot of people with diabetes: neuropathic pain. It's one of the most painful complications of diabetes, and unfortunately, the treatments available right now are pretty limited.
You're right, Emma. Diabetic neuropathic pain, or DN, is a real challenge for about 20% of people with diabetes. It's caused by nerve damage from high blood sugar over time, and it can lead to some serious pain. But here's where stem cell therapy comes into play again. Scientists are looking at mesenchymal stromal cells, MSCs, for treating neuropathic pain.
I've read that MSCs can actually help reduce the pain and regenerate damaged nerves. They do this by modulating the immune response and promoting nerve growth. Studies on animals have shown that MSCs can lead to significant pain reduction and even improved nerve function.
Exactly. And another exciting aspect is how MSCs secrete anti-inflammatory cytokines, which help fight off the inflammation that worsens nerve damage in diabetic patients. It's another example of how stem cell therapies can do more than just manage diabetes. They can help treat its complications, too.
That leads us to the bigger picture, Alex. Stem cell therapies like these could be the future of diabetes care, not just for insulin production, but for all the complications that come with the disease. As we refine these techniques, the potential for treating diabetes and its complications could really expand.
No doubt, but as promising as these therapies are, there's still a long way to go. Scaling these treatments for widespread use isn't easy. Each patient's response is different, and the process of reprogramming and transplanting stem cells can be technically challenging. That's why clinical trials are going to be crucial moving forward.
Right, we're still in the early stages, but the progress so far is incredible. The idea of using a patient's own cells to treat their condition is a huge step forward. If we can overcome the challenges, we could be looking at a whole new era of personalized medicine.
Speaking of complications, let's talk about chronic limb-threatening ischemia, or CLTI. This is another serious issue for people with diabetes, especially when it leads to amputations.
That's a big one. For people with CLTI, especially those who can't undergo standard procedures like bypass surgery, stem cell therapy could be a game changer. Autologous cell therapy, or ACT, uses a patient's own stem cells to improve blood flow and heal foot ulcers, which are common in CLTI patients.
And the results have been really promising. Studies show that ACT can significantly reduce the risk of amputation and speed up the healing process for foot ulcers. Plus, with advancements in gene therapy and nanoparticle technology, we're seeing even more potential to enhance these treatments.
So we've talked a lot about cutting-edge therapies, but what about natural remedies? There are some really powerful natural treatments for diabetes too, like aloe vera and quercetin.
Aloe vera is one of those that's been around for centuries. and it's showing serious promise in modern diabetes care. It's been shown to lower blood sugar and even help restore pancreatic islet cells, which are crucial for insulin production.
Aloe vera doesn't just help with insulin production, though. It also protects other organs that are affected by diabetes, like the kidneys and liver. It's a perfect example of a natural remedy that can complement conventional treatments.
And quercetin is another standout. It's a natural antioxidant that can help improve telomere length, which is a huge factor in cell aging. In people with type 2 diabetes, quercetin has been shown to help with glycemic control, blood pressure, and even sleep quality.
That's why combining natural remedies like aloe vera and quercetin with modern therapies is such a great approach. You get the benefits of both worlds, cutting-edge science and the healing power of nature.
Let's not forget that in the Lost Book of Herbal Remedies, we have a fantastic herbal formula designed specifically for diabetes care. It's a powerful combination of herbs that addresses key challenges in managing diabetes, like insulin sensitivity, glucose regulation, and even nerve health.
That's right, Alex. First up, we have Gymnema sylvestre, also known as Gurmar. This herb is known for its ability to enhance pancreatic function, promote insulin release, and potentially regenerate pancreatic beta cells. It even reduces sugar absorption in the intestine, which is key for maintaining stable blood glucose levels.
Next, we've got aloe vera. We already talked about how aloe vera helps restore pancreatic islet cells and reduce beta cell damage, but it also has anti-inflammatory effects that reduce complications from diabetes.
And then there's berberine. It's derived from plants like Berberis vulgaris and Coptis chinensis, and it's been found to improve insulin sensitivity, promote glucose uptake in tissues, and lower blood glucose levels. Plus, it helps with lipid metabolism, which is important for heart health in diabetics.
A key ingredient here is cinnamon, specifically Cinnamomum verum. It contains bioactive compounds like cinnamaldehyde, which have been shown to improve insulin sensitivity and lower blood sugar levels.
One of the lesser-known but powerful herbs is Salacia reticulata, also called Cathala himbutu. It inhibits carbohydrate digestion and absorption, which helps reduce post-meal spikes in blood sugar and improve insulin resistance.
Don't forget quercetin, the antioxidant powerhouse we talked about earlier. It improves telomere length, reduces oxidative stress, and supports endothelial function, which is key for overall health in diabetics.
And finally, alpha-lipoic acid. This antioxidant is great for improving insulin sensitivity and can even alleviate diabetic neuropathy by reducing oxidative stress and nerve damage.
This formula really covers all bases. It combines these powerful herbs to enhance pancreatic function, improve insulin sensitivity, regulate blood glucose, and support nerve health.
It's a holistic solution that not only targets diabetes, but also helps with its complications, like neuropathy. And remember, it's crucial to complement this formula with lifestyle changes, like regular exercise, a balanced diet, and proper monitoring of blood glucose levels.
And as always, be sure to consult with a healthcare provider before starting any new herbal regimen, especially if you're managing a chronic condition like diabetes. That's it for today's episode. We've covered a lot of ground: stem cell breakthroughs, natural remedies, and how these therapies can transform diabetes care. If you're interested in learning more, visit herbalbloom.org for the full article and detailed information.
Thanks for listening to the Lost Book of Herbal Remedies. Stay healthy, stay informed, and we'll see you next time.